Yes. So my name is William Fawcett, although most people call me Bill. I'm 63 years old. I work in the NHS as a doctor, and I'm also a professor at the University of Surrey. And yeah, I think that's it. I'm still working full time, and yeah, that's it. I mean, I guess pretty much the same for everyone. I mean, I think certainly when I went to school in the 60s and 70s, people were probably a bit less restrained than they are today. They might sort of take the mickey out of you, and sometimes you can laugh it off, but sometimes it can be quite impressive when people may be laughing at you, or maybe just poking fun, but it's not it's obviously not entirely pleasant. That having been said, that was pretty unusual. And although I faced the same things that lots of people face during their education, so everybody has to do a degree of public speaking of some sort, even as a 10 or 11-year-old in class having to read out a paragraph from a book or ask questions or whatever. I probably hated that most of all, and I hated it more when I was younger. I think as I got older, it probably bothered me less. And it certainly hardly bothers me at all now, but I can still remember being excruciatingly and feeling excruciatingly awkward when people were asking me things, or if I had to stand up and say something in front of the whole school or whatever. So that was really my time through primary and secondary school. And then when I went to university, I think it became less of an issue. And also there were some people there who actually were able to access for me some speech therapy. And I think that helped. But I think one of the things that happened is that I got older and I just became a bit more confident in myself. And so I think it upset me a bit less. I think I'd only kind of finish this little bit by saying that I sort of kept on thinking it would finally disappear. And I think my father had a speech impediment as a child, and he kind of grew out of it, or whatever that means. But clearly I haven't. And at sometimes, like when I'm under stress, and particularly when I'm tired, I'm much more conscious of it.
Cayman?
So some of the speech therapy I had kind of taught me a little bit of relaxation. I think that helped. It also taught me kind of techniques for kind of almost slurring words into each other. So if you were conscious that you may be about to come across something tricky, you could kind of slur the word before into that word, and sometimes that helped. Other than that, I mean, there were things that I struggled to overcome, and I mean, even silly little things now I don't particularly enjoy, like if you ever go to Starbucks and they ask you your name to put it on your cup of coffee, even that I sometimes find awkward. Yeah. I mean, I've kind of been a bit masochistic, really, because I've kind of do quite a lot of public speaking, which I don't. Um, if it's something I really hated, I could have easily have avoided it. But actually, sometimes when I'm I'm well prepared, and I've got time to think about things and practice things in advance, it normally works extremely well. I think the problems come when you're kind of suddenly forced into a situation that you don't know, and I still find that quite a difficult area, because obviously you can't prepare for it, whereas if you're doing a talk or lecture, you've got time to prepare in advance. And if particularly if you're doing the lecture with slides, for example, you can use the slides to help you to kind of navigate through. So that's how I cope with normal things. I mean, I have to say it does involve a lot of how you feel and how confident you feel. So if I know exactly the environment I'm in, I know exactly what I'm doing, then I would say I would hardly stammer at all. But as I say, if I'm thrown into something unusual, I then that's when things sort of start to go wrong. I would say don't ever give up. There's plenty of help out there. I think the thing that I have particularly learned is that I'm generally much more conscious of it than people around me. And certainly some of the people who know me well would hardly, if you asked them, they would probably sort of hardly think it was something that was particularly noteworthy. So I think the stammerer always perceives it as much more of a problem generally than the people to whom they're trying to talk. I mean, I hope to sort of let people know that having had quite a severe stammer, it's not held me back from doing the things that I want to do. It sometimes is a bit frustrating, and sometimes it takes a little bit of extra time. But I would hate for me, and indeed for anyone else, to feel that their speech impediment had in some way kind of made it impossible for them to do the things that they particularly wanted to do. And so, one always has to find a way around it. It's not always possible to do it smoothly, but, there's very few things that you can't do. It may be uncomfortable and it may be tricky when you first start, but don't give up on, what your dreams and aspirations are. Yeah, I mean, I think the thing about doing, well, certainly the job that I do, that the speaking part of it is really just such a tiny part. I mean, the reason why any of us do the jobs that we do is because we're able to do them anyway. And it's such a shame to think that there are people who could easily be great academics or great doctors or whatever, and feel that they can't because of that. That's absolutely not the case at all. And that's, certainly I think these days we live in a very diverse community. There are people in the workforce with all sorts of issues and needs, many of them much greater than having a stammer, and that they're able to overcome them. Yeah. I mean, I think that having a stammer can make people quite shy, because, particularly if they're in an environment where they don't know people. I mean, I think for me, and I mean, even now, walking into a room where I don't know people and having to introduce myself and having the extra layer of a problem with the stammer as well, I find that particularly hard. But I tend to find that I worry about it much more than the people around me do. And I kind of have to tell myself that, you know, although it may not be very comfortable for me, it's all fine. It's not as if there's any kind of lasting damage at all. It's really, you just have to know that you will overcome that particular situation. I've kind of stopped doing what I used to do, I think, as a younger person, which is trying to find ways to express myself differently. So if I knew there was a word or phrase I would have a struggle with, I'd try and find an alternative way to kind of bypass that. But I think now, as I say, you know, there's not much good about becoming older. But one of the things is I think you're probably a bit more relaxed and a bit more comfortable in your own skin.